Well, hello everybody. I'm Teresa Snow and I'm so glad to be on the KRCG Facebook page. We're here for a special Facebook Live edition of Focus on Your Health. And I'm joined by Dr. Andrew Wheeler. You are Chief of Bariatric Services, Medical Director of Bariatric Services here at MU Healthcare.
That's correct.
Thanks for joining us.
Thank you, Teresa.
So we've picked the topic for our first Facebook Live of weight loss surgery. It's something that so many people are curious about, and many people, this will benefit them greatly. It's very effective in helping people lose a great amount of weight. Tell me, who would be a candidate? Who are we talking to who might be interested in weight loss surgery?
So generally, Teresa, we're looking at people who have a BMI above 40 or a body mass index above 40, and that's roughly about 100 pounds over someone's ideal body weight. The other group of people that are eligible are people whose BMI is between 35 and 40, but have medical conditions associated with their weight or their obesity, because we know the profound impacts that weight can have on medical illnesses as well.
Tell me about some of those. That might drive somebody as much as, I want to lose weight, I want to stop this chronic disease. Tell me about some of those conditions that might drive someone to your clinic.
You know, when you look at conditions that are associated with obesity, it really spans the full spectrum of medical illness. Everything from high blood pressure to diabetes to heart disease, even putting people at risk for cancer. And the profound thing that weight loss surgery can do is it can put these diseases into remission. So people's diabetes can go away after surgery. Their sleep apnea can come to the point where they no longer need that CPAP machine. It can even decrease the risk of cancer long term. And most significantly, it can actually extend people's lives.
What a big change if you're used to sleeping with a machine or taking medicine for diabetes to not have to do that anymore?
Absolutely. I mean, just if you talk to a patient who has diabetes and the idea of sticking their finger multiple times a day and checking their sugars and going to their doctor every 3 months and hearing, oh, your A1C it's gone up a little bit, we're going to have to increase your insulin, to be relieved of that burden is quite significant for people's lives.
So we're Facebook Live, and I'm going to talk for about 30 minutes with Dr. Wheeler, but I would just as soon ask some of your questions as my questions, although I have a great list here. So be sure to make a comment, and they'll pass them to me, and I'll try to ask your questions as well today. So we talked about it being an effective treatment. What about people who try to lose those 100 pounds with exercise, diet? It's tough.
Yeah, Teresa, it's very tough. And unfortunately, the body is made in such a way to not lose weight. It's one of the reasons that in the world history that starvation, although is present, the body is very resilient to starvation. The problem is that when we're in a state of where we are in the world right now, when for most parts of the world, fortunately, food is in abundance. In the United States, food is very cheap, and unfortunately, a lot of the food that is the cheapest and most cost-effective to buy is also unhealthy food.
Junk food.
Correct. The food that's easy, the fast food that's easy in our busy lives, is also not healthy. And so when you have a body that preserves energy very well, and it's very adept at not losing too much weight, when a person tries to lose weight and they do things to try to limit their calories and even increase their activity, the body resists that. And the body resists that through hunger, through slowing metabolism and any number of things, many of which we don't understand. So when we're consuming high caloric foods that are easy, as our physical activity goes down because of technology, as we spend less time outside. Winter is one of the most difficult times. And what we see is people's weight goes up. And studies have shown that on average, people usually gain 1 to 2 up to 5 pounds a year. And over a person's many years, that weight adds up.
Yeah, it's harder as you get older, too.
Absolutely.
Yeah. So I'm Facebook Live with Dr. Andrew Wheeler from MU Healthcare. It's a special Focus on Your Health. We're talking about weight loss surgery. There are various types of weight loss surgery, and I guess the type that you need depends on who you are. I mean, It's very individual.
Yeah, absolutely. And one of the things that we pride ourselves at MU Healthcare is to offer truly a comprehensive program. And part of that comprehensive program is offering a variety of surgical techniques to help people because each person's different. Not one procedure is right for every person, nor should every person have the same type of operation. And so if we only offer one type of operation, unfortunately, we're either giving the wrong operation to a person or we're not able to offer the right operation for a person. And so we really try to gear the patient and the operation together, match those two up so that a patient can have a safe, effective operation that meets their needs, that treats their illnesses.
I was going to say, it's probably safer if you have the right operation for your needs. Tell me about the safety. How have things changed over the years?
Yeah, so when I started doing this probably about 12 or 13 years ago now, we knew that the death rate of weight loss surgery is high as 1%. And that's fairly remarkable. When you do hundreds of operations a year, that means that a significant number of people could be dying. And what we find now is that the death rate is almost zero. When we look at even across the country, even though our rates here are lower than the national averages, when you look at the national average of death rate now with weight loss surgery, it's approaching zero. It's 1 in 1,000 or less. And that's a huge change for people, because now people can have these operations. And although my patients, as they come in, they may have some anxiety and some nervousness, we can tell our patients, hey, we can do this operation and we can do it safely.
I bet there are a lot of fears. Well, I mean, it's this life-changing operation, and you want a life change, but are people asking you, will I be able to eat normally after this? Will this totally change my relationship with food and my ability to eat? What do you tell them?
Right. Well, and that's kind of two different things. So the good thing is it does change people's relationship with food. People are satisfied full with much less food. People are, a lot of times people's cravings go away. The baseline hunger that people have, as I mentioned before, that is the body's way of not losing weight. A lot of people after weight loss surgery no longer get hungry. It helps people avoid eating large meals. And yet people still eat normal food. People still eat a normal types of food, a normal diet. Some people come in and they say, am I just going to be on baby food the rest of my life? And it's not. You know, we go through a diet progression, but at that point, people eat fairly normal food with their family members, going out, going to parties, being social. They don't have to restrict themselves to kind of a weird diet that makes them seem different.
Yeah, that's good to know. Is there fear my life will be different in general, or is it basically around food? Tell me about some of the other questions you get in the clinic.
Yeah, I think one of the biggest things that we hear patients talk to us about is the idea that they've had family members or friends that may have had a weight loss operation and had an adverse effect. And I think that goes back to your earlier comment about the improvement of weight loss surgery, and that a lot of patients that are experiencing, that have experienced problems in the past, we've improved from that point. We've improved. The technology is safer. Patients recover sooner. Most people are going home the next day from the hospital, maybe 2 days. And the times where people have lifelong limiting issues that plague them is very rare now. And so some of those fears that patients have and they bring to them with us, we're able to ease as we explain just how effective and safe procedures are now.
We appreciate you asking questions on the Facebook live stream, because like I said, I'll ask your questions if I can. Mandy says, what's the first step to get started? I guess you can't diagnose over the air, right?
Right. Yeah, that's, Mandy, that's a great question. Being approved for and having weight loss surgery for a lot of patients is a process. Some of it is mandated by insurance. Some of it is mandated that we want to do what's safe for patients. We want patients to understand the risks. We want patients to make sure that their health is optimized to having these weight loss surgeries, so that we can keep complication rates low for people.
The better you are going into it, the better your recovery is going to be.
Absolutely. And one of the other things that we pride ourselves at MU Healthcare is we don't see this process as just a checklist to qualify people for surgery, but we really want to optimize you for your operation. There are some things that are mandated by your insurance company, for instance, a psychological visit, some dietary education, and we use those things to really make sure that people are ready for surgery and can have a successful outcome. So really the first step is you can go online to our webpage and enter your information, and we'll call you and get you set up for a visit. You can also call the office and we can get you set up for a visit. One of the first things though is we will verify your insurance coverage, make sure that your insurance covers it, because not all insurances do cover weight loss surgery.
But you find that many do. Most do.
Many do, and a lot of the patients that come to see us do have insurance coverage. So even if you think, oh no, there's no way my insurance will cover it, patients will be surprised, and they should definitely reach out to us, because even if you don't have coverage for weight loss surgery, we have a very robust medical weight loss program that can also help patients in that way.
Gina is asking, Do you have to take a lot of expensive supplements after surgery? You mentioned they can eat normal food, but what about supplements?
Yeah, so probably one of the most shocking things for people is we talk about vitamins, and we talk about the need for lifelong vitamins. And people's first question is, how much is that going to cost? Because that sounds very expensive. But a lot of the vitamins that we recommend is one pill once a day plus some calcium. And one of the vitamins we offer and recommend is about $12 a month. So not too much more expensive than a typical over-the-counter vitamin, which we probably all should be taking anyway.
I'm guessing if they're taking multiple medicines for health complications, this might be less than diabetes medicines and supplies and all those other things they might be using for some kind of a complication.
Yeah, absolutely. And
Yeah.
most research studies show that between 2 and 4 years, the cost of the weight loss procedure. Now, we're not talking about the cheap cost of vitamins, but we're talking about what an insurance company would spend on a weight loss procedure. But within 2 to 4 years, the cost of that operation becomes cheaper than the medications that patient would have needed to spend on those medications during that time.
That's why it's a good bet for the insurance companies.
Absolutely. You
Yeah.
just have to convince them of that.
Yeah, yes. So why an academic health center like MU Healthcare? Tell me about your team. Who all is a part of that and works with a patient?
Yeah, so we have a very robust, very comprehensive team. So this extends from our clinic staff, our nurses. We have very well-trained bariatric dietitians. We have a behavioral health provider who runs our behavioral health program. So that's integrated with our program as well. We don't tell patients, you have to go find your own, psychologist to do your preoperative health assessment. We have one that will do that for our patients, who provides one of the most comprehensive, excellent health assessments I've seen. We have a group of 5 surgeons that work very closely together, who are all trained in bariatric surgery and have been doing bariatric surgery for years. Between the 5 of us, we've done thousands of weight loss operations. We have excellent nurse practitioners that will provide excellent continuity of care for our patients. In addition, we're a center of excellence, and not all programs in this area or even in the state can say that they're a center of excellence. And what that means is that the American College of Surgeons and the American Society for Metabolic and Bariatric Surgery have a joint effort to monitor quality, to monitor complications, to monitor that we're doing things to help our patients be effective and safe. And so we're a center of excellence in that, which means that we offer the highest quality of care that is possible for a patient having weight loss surgery.
Thank you. We're so glad you're joining us. This is a special Facebook Live edition of Focus on Your Health. I'm joined by Dr. Andrew Wheeler. He's Medical Director of Bariatric Services and Chief of Bariatric Services at MU Healthcare. We say bariatric, but that refers to the stomach? That refers to weight loss.
To weight loss surgery.
To weight loss. Got a question from Delisha. She says, do you have an office in Jeff City? And I'll let you answer that question. Then let's talk about how you're reaching out to people who are traveling quite a distance.
Yeah, absolutely. So we don't have an office in Jeff City. A lot of the operations, or all the operations we do here, we have, to your earlier point, in our standard of care, our nurses on the floor and our operating room staff are very well trained to take care of our patients. So right now, we do all of the operations here at the University Hospital for MU Healthcare. We see all the patients through clinic, but we do have services that we can help people that are traveling from a distance as well.
So your clinic is off campus. Do surgery at University Hospital. Off campus in South Columbia is the clinic, off Nifong.
Yep.
And then you do telehealth visits with some folks that are further away that have to do follow-ups. What are they, on their phone, on their computer?
Yeah, so at the offsite clinic, it really offers patients the ease of being able to drive up, to park, to walk in, to not have to navigate a large hospital. But we also offer patients the ability to do what we call video visits. So it's an inpatient, Skype or FaceTime visit that allows us to speak face to face, just like we were in the office having a conversation. And we're able to do that so that patients can, instead of driving maybe hours away, waiting in the waiting room, having the office visit, and then driving back home, and sometimes spending half or their entire day for an office visit. Now we're able to do it from the comfort of their home, the comfort of an off-site location that's convenient for that person. We do it in person. We have the same conversation as we would have if you were sitting next to me in the office. And then we can work with patients to coordinate getting their labs done and things like that, so that we make sure that the same standard of care, the same education is done throughout.
You're passionate about it. How did you pick this type of medicine? So many surgeons will, I guess, take out your appendix and never see you again. You know, surgeons are somewhat separated from the patient after the procedure,
Right.
but you really have a relationship with them for a long time, and so does your team.
Yeah, absolutely. You know, there's an old surgical saying, the chance to cut is a chance to cure. And so the ability to help a person and cure disease and even prevent disease is the big reason I went to this specialty. And day in and day out, that decision is affirmed as I talk to patients and give them hugs, and they talk about the 100 pounds they've lost and their diabetes that's gone, and the ability to ride a roller coaster with their children is why I do this and why I'm excited every day to go to work.
That's good to know. We had a lady ask a question before we even started the Facebook Live, and she said, what about those people who gain the weight back? How often does that happen? Is that common?
You know, weight regain after weight loss surgery is uncommon. It's especially when you compare it to something like diet and exercise, which we know people really struggle to be effective with. Most data suggests that about 3% of people with diet and exercise are able to lose 10%, only 10% of their body weight, and keep it off. Whereas with weight loss surgery, we know that greater than 80% to 90% of people are able to lose, 20 to 40% of their body weight and keep that off for the long term. So everyone probably knows someone who's had weight loss surgery, because I hear it all the time, and they say, oh, my neighbor, my friend, or my family member, oh, they had weight loss surgery and they've gained their weight back. But that's really the much more uncommon situation, not the norm for most people having weight loss surgery.
And your patients have support. Like on Facebook, there's a Facebook group where they're sharing stories and these roller coaster stories and pictures. Tell me about the support.
Yeah, so we have two excellent dietitians that kind of manage our Facebook support group. We have monthly in-person support groups. Part of our telehealth, our video visits, is we want to also be able to extend some of these services out where people can even do it from their home instead of having to travel from distances. And so the goal is that we don't just do surgery, we do an operation, we send you on your way and say, hey, hope this is successful, but we get you ready for surgery. We make sure you're safe to have an operation. We do the operation, and then we have really lifelong ongoing care for patients. We have an integrated medical weight loss program, so that if people are struggling after weight loss surgery, because sometimes people's hunger may return, we have medications to help people be successful. And the goal is to recognize early struggles people may be having, to plug them in with the right resources to help them maximize their success long term.
So that kind of answers the question that we had from someone who said it would be great, helpful for evening classes, internet. That support group is really that off hours, ask a question. I see people ask questions in the Facebook group and get some good answers there. So Donna was asking about the couple that we saw during Focus on Your Health during the 6 o'clock news on KRCG. So every week, 6 o'clock on Wednesdays, 6 a.m. and noon on Thursdays, we have our Focus on Your Health segment from MU Healthcare on KRCG, my former employer. John and Laura Huntley were the couple that we featured today. Tell us how they're doing. They saw dramatic weight loss and they worked together as a couple.
Yeah, absolutely. They're doing quite well. Their weight loss is tremendous. Their improvement in their health is quite remarkable, and they've really committed to the process. They've put in a lot of hard work. One thing I hear from patients is they say, well, I talked with so and so, and they said this is cheating. This is the easy way out. And I think if you talk to John and Laura, you'll realize that it's not easy. It's not the easy way out. But they've put in the commitment, and they've been really very successful. They look great. Their health is great. They're doing really well. So, and that's been fun to walk along with them.
And people always have those suspicions. Will I be sorry that I did it? You don't hear that from folks. You hear they're really happy that they made these life changes.
The most common thing I hear from people is, I wish I would have done this years before. We will operate on patients who are even into their 70s. And they come through that, they lose weight, and they're like, I wish I would have done this 20 years before, because they see the profound impact on their health.
Follow-up services, we talked a little bit about those video visits. Jean is asking about follow-up services. What is the commitment for the clinic? You're going to be coming for a period of time before you determine the right surgery and the right time for that. what is the commitment and the follow-up afterward as well?
Yeah, so once we assess the patient, they have their operation, we have several scheduled visits after surgery to maintain that quality to improve people's outcomes. So we see people at a week, and that week visit is generally geared towards making sure things are healing up and they're doing okay. We see them at a month to continue advancing their diet, again monitoring for any issues the person may be having. Then we see them at 3 months, and at 3 months we're checking their vitamin labs to make sure they're not developing any nutritional deficiencies, and if there are any minor deficiencies, we're making sure that we give them guidance on how to improve that. Then we see them at 6 months, and at 6 months, and then each year after that is we do visits, and there it's ongoing weight management. It's helping people, it's discussing their struggles, it's celebrating their victories, making sure that they're not developing any vitamin deficiencies. Adding medications, as I mentioned before, is necessary, but it's really that ongoing weight management that we do, and we will take care of people for as long as they'll come back and see us. So.
How long before somebody would go back to work after surgery? That was a question Delisha asked.
Yeah, so it really depends on the individual. It depends on what they do. We have people that do light duty or desk work that may go back in as soon as a week out of surgery.
Wow.
I generally encourage people at least come see me that first week and let's make sure you're doing well before we cut you loose. Some people who work from home will even go back the day or two after they get out of the hospital.
That's incredible.
Yeah.
That's incredible. So how long is the hospital stay?
Yeah, so most people will usually spend 1 night in the hospital. Everybody spends at least 1 night in the hospital. Some people and they go home the next day. Some people not even 24 hours before from their surgery until they're home. A few people will end up staying a second night, still trying to get their fluids in, get their energy back, but over half of our patients will go home the next day.
What a change. I can imagine probably when you started that was a longer period of time. I'm grabbing more questions here. How long is the recovery after surgery? And you pretty much just said it could be fairly short to get you back to work. I imagine you'd feel drained, but it's amazing how quick surgeries go these days.
Yeah, so
is that because people are so better prepared going in? What have you seen change over the years?
We've seen getting people more prepared, I think, is a good point. I think we have improved technology that allows us to do the operations, safer and quicker. And the speed of the operation, a lot of that comes to the shorter the time the patient's under anesthesia and asleep and is on the ventilator, the better they do. Mm-hmm. And so, for instance, for a sleeve, we can usually get people on and off the operating room table in an hour or so. Even for a gastric bypass, it's usually an hour and a half. And so this compares to sometimes, and even some places around the country where that could be a 3 or 4 hour operation. And we know that the longer you're under anesthesia, the more potential complications you have. And what that's allowed us to do is even take people who have some significant medical problems. They're on dialysis, they have liver cirrhosis, congestive heart failure, on home oxygen, and do these operations safely and effectively. And we see these diseases then go away. We see people's fatty liver disease improve. We see people come off of oxygen that they've been on for years. We see people's their heart starts to function better, even their kidneys start to function better. And so people are who previously probably would have died within a few years are now able to extend their life many years.
Talk about a new outlook on life. Let's throw up the number. You get started by calling 882-LOSE. Check out our website. It's muhealth.org/weight-loss-surgery. We're going to go live here for about 30 minutes, so give me your last questions on Facebook. And one that no one asked, loose skin. What people probably ask you about that.
Yeah,
like, is that going to be a big problem?
Right. Yeah, and that's one of those things that I wish I could predict for people. Will they have loose skin? I can say that the more weight that people lose, or in other words, the higher their weight is over their ideal body weight, the more loose skin they will have. Some people this is troubling, and that's understandable. Some people are concerned about that, and that's also understandable. I try to encourage people, though, that there are surgical options for skin removal. Insurance coverage is sometimes an issue, but oftentimes people will have coverage and they didn't realize it. But I try to encourage people that although the loose skin may be troublesome, the improvement in your health in the long run, I think, in their minds will win out of, I'm sure glad I did this.
And you don't usually hear from people, I'm sorry I did this because of the loose skin. Usually it's
Correct.
not.
That's not
yeah.
what we usually hear.
healthy.
Yeah.
Okay, well, I'm going to wrap it up. I'm Teresa Snow. It's a special Facebook Live edition of Focus on Your Health. I'm here with Andrew Wheeler, who is Medical Director of Bariatric Services at MU Healthcare. I'm just going to tie a bow around this because Carrie made a comment. She says, no question but a comment, it was the best decision I made for my life. So thank you very much, Carrie. We appreciate that. And thank you for joining us for this Facebook Live. Thank you, Dr. Wheeler.
Thank you, Teresa.
Good night, everybody.